Yeah, hi, I'm Dr. Michelle from Premier Clinic. I'll be working for the past few years already in this field, almost like 6 to 7 years, almost 8 years already. Actually, in our Premier Clinic, we offer all the non-invasive aesthetic procedures, which is recommended for men and women as well. So depends on the ages what we do, but most of the Asian people, they are more concerned like their outlook beauty, especially those that are wrinkles, fine wrinkles that we can get in very young age, maybe sometimes, especially those that crossfit. So when it happens, so what we will offer them, so usually it's very general, Botox. Usually Botox is temporarily stop the movement of muscles. So usually after you Botox this area, when you smile, you can't see any fine lines here. Or sometimes when we do the Botox over the forehead, so when you lift up, it's very minimal, the movement muscles can be stopped for time being, so that it can really lighten the wrinkles. Some people, when they want to move for more things like middle-aged people, like 30 plus years old, they prefer to have more volume over the cheek area because the volume loss. So what we will offer them is the filler. You know, when we try to inject here, it can volumize the cheek for them to look much more younger. Men, we do offer a filler, but sometimes for Asian people, their concern is the nose. You know, when their nose is very not so high, they want to have a 3D look of the nose, so we can do a filler for the nose. So when those filler, we can do for the nose here, enhance the nose. When they have a very flat nose, you know, Asian, Chinese, it's very common. For Asian, our concern is our outlook appearance, so especially for the skin. So Asian people very prone to get hyperpigmentations, those that different pigment on the skin, like those that melasma, a lot of dermal pigments, or maybe freckles. So in these kind of situations, maybe after we consulted the patients, maybe we can offer few choices for them to cure the pigment. You know, first thing, maybe we can do the laser. As you know, Q-switch laser is very well known for the pigment. So maybe sometimes we can offer those chemical peeling for the peel off the superficial surface of the skin for the pigmentations, or maybe sometimes we do inject some of the stem cell to cure for the pigmentations. Sometimes when patients having a very dehydrated, very dry skin, so we will offer them some skin booster to inject on the surface of the skin to give more hydrations. You know, when the skin is very dry, they are very prone to get damage. So it will get hyperpigmentation as well. You know, some people, when you have a very small jaw, then here, the chin here is very short, you know, like almost like no chin. You inject the filler here, make the chin more elongated, more volume, so that will give appearance of longer chin and sharper face. So we inject on the top of the bone to give you volumization, volumize here, and elongation of the chin. Causes of people losing hair, maybe due to stress, maybe due to some women who is having hormonal imbalance, like those PCOS patients, or maybe some aging patients that is having some menopause, and then maybe some other disease, people having some thyroid problem, or maybe some pregnant women, after they deliver baby, they'll be losing hair. So actually each treatment for each patient is different. So commonly when we do hair treatment for patients, we do offer those injections for the scalp area. So what we can do, here we can do some stem cell, hair stem cell, some mesotherapy, or maybe some PRP as well. So when women having more hair loss, for like a female pattern hair loss, so we can maybe in future we can offer hair transplant for the patients. At the same time, patient need to get some like hair grow shampoo, some supplement, some hair grow product for them to maintain as a home maintenance. Is very important. I cannot say 100% successful, but at least that we can deliver 80 to 90% to hair loss patients. They will be very grateful. as you know, like those people, women, they're having some hormonal imbalance. First at all, you need to treat the hormone as well. If you do not treat the hormone and we are only treating for the hair loss, the success rate is not so good. Usually the dermal filler, when we do for patient for volumizations and like those that nose enhancement, chin enhancement, it depends how many syringe you need. Usually in the market it will range from 1,008 to 2,005. Depends on which type of filler that you use.